and say welcome everyone to our cognitive behavioral therapy course preview. Let me introduce you Dr. Sumitra, who is a medical doctor and a clinical hypnotherapist, and she also is the person who essentially runs the CBT course. So it's an absolute pleasure to have her with us. She has a specialist in clinical hypnosis for medical care, but also uses clinical hypnotherapy in cancer care too. And of course, being our resident CBT expert as well. CBT is certainly from the REBT branch of CBT, which she's going to be talking to you about. A little bit about CBT. We'll be talking to you a little bit about the course and what it entails, and then we'll open up for any questions you may have. Dr. Sumitra, it's over to you.
Thank you very much, Peter, for the introduction. Yeah, as Peter said, I run the CBT course, and I would really like to introduce this course to you all because I have been doing it, I've been practicing it, and I can vouch that it's a very elegant, very effective method of therapy. We are more interested in introducing this to you because once you are a therapist, and this like CBT or any other kind of therapy is very much aligned with hypnotherapy. Or I think most of you are now studying or have finished a course of hypnotherapy. Even if you didn't, CBT is something you can use solo. And CBT is written here. It's a game changer for modern minds. The way we do therapy has really changed much. And then we integrate many things into many kinds of psychotherapies. CBT is one of it that will fit very well with those who practice hypnotherapy too. In the beginning, psychoanalysis, I think everybody knows about psychoanalysis, Freud's method of treatment, therapy. It was very powerful and very popular, but as you know, it was a very long, drawn process. Some clients had to go 1 year or 2 years through psychoanalysis. But of course, it was a very powerful technique. And then there was a need for us to provide this more brief and structured and more effective therapy, which was formulated for Vietnam veterans. The time management was difficult. Therefore, they went into finding this brief therapy, which is we are going to speak about. The important thing here is it is based on the rigorous testing of the behavioral therapies, and it also continues in that particular tradition rather than the introspection of psychoanalysis. This is much shorter and present concerned, and it is very powerful and quite quick. Research also, you may go into some research and find for yourself. It also has this, because of the rewiring of the thinking patterns, people, when they go through CBT, the neuroplasticity, the neural pathways that were making people anxious or having to go through many other emotional and psychological issues, anxiety, depression, stress, and all that, the whole brain rewired into a better mode of emotional stability. This is recommended by Global Health Organization, NSH, and HPO, APA, and WHO. And it has been used for long in hospitals, therapy, one-to-one, group, coaching, leadership, training, and also schools. We see the benefits. CBT is a model that works. It's evidence-based, actually. People get better and faster. It's a good choice for you to provide a more therapeutic framework, which is very professional. And it also provides therapists with you and your client very good therapeutic model and a framework for most of all managing their lives after they go through this program, the process, the protocol of CBT. CBT, it is understood that it transforms therapy with a structured, very scientific-backed approach. Unlike our traditional talk therapy, of course, we had many, but CBT is evidence-based and it is results-driven. Giving therapies a clear, structured framework to help clients to reframe their negative thought patterns that they are always going through constantly because of their discomforts, the events that they are negative, disturbing events that they go through in their lives. It changes, people have thought patterns regarding their discomforts. And these thought patterns are unhealthy, negative. The CBT reframes these thought patterns and change into more adaptive and building resilience and take control of their mental health and also their lives. This makes the sessions more focused, therefore, and very goal-oriented and effective. This expands also your reach and increases employability also as a CBT widely recognized in hospitals, mental health, but you got to incorporate it into your existing therapy method. But you can use CBT modular and you can take it different aspects of CBT to educate your clients, change their thinking patterns. That is possible. Mental health, corporate wellness programs, and therefore all these places where people can have a change of thinking pattern. They need to have a thinking pattern, and therefore this is a sought after skill for any therapist. Whether you can work virtually, you can work in person, integrating CBT into your practice enhances credibility, attracts clients, and opens doors to other and new professional opportunities. It also empowers your clients for lasting change. This is the important thing about CBT. Like in psychoanalysis or any other method, you will be getting results, yes, but CBT affects lasting changes in people. And CBT doesn't really pay much emphasis on past experiences, but it is completely current centered. CBT equips your clients with practical tools. This is one of the most important things about CBT, practical tools to change their present and their future. Therapists use this CBT help to clients break free. Very often there's self-sabotaging behaviors that arise from the unpleasant incidents and disturbing events that happens to them. They learn to develop very powerful coping strategies, and this will create that which they can practice on their own when they have finished the therapy, and this creates the real transformation and leading to higher client satisfaction and also, of course, long-term success. And once the person goes through the process of CBT, they learn how to handle their life in another situation, which may be similar or different. They become their own therapists very often. Psychotherapy in evolution. There are 5 core models for CBT. Behavioral therapy is focused on systematically changing the person's behaviors when the person has a problem, and then it results in maladaptive behaviors. The behavioral therapy is focused on changing those behaviors. Cognitive behavioral therapy recognizes the roles of the thought or the cognitions that the clients have that give rise to also negative feelings and, emotional or psychological disturbances. And for CBT, there are 2 primary models. One is the Beck's model and the other one is Ellis's model. Generally, they both are very, very similar. They can even overlap, but there is some subtle differences in the two. Ellis's model is called REBT, Rational Emotive Behavioral Therapy. From there, you can see being rational about your emotions, thereby getting your behaviors to be, adaptive. Ellis's model does that. Traditional cognitive behavioral therapy, CBT, is Beck's model, and rational emotive behavioral therapy, REBT, is Ellis's model. And there are others. The other types are mindfulness-based cognitive therapy, ABCDE. You also have that. And there's the schema therapy and behavioral activation therapy. These are the types of behavioral therapies, cognitive behavioral therapies that you may find. The important thing is that CBT has the power to reshape people's beliefs, negative beliefs, into empowering ones. This is powerful, and is quite very elegant and very effective. It has been time tested. Now, the 5 core model of CBT and why ABCD stands out, the Ellis model or REBT stands out. CBT actually started and it evolved into multiple models, as I just mentioned, and each offering very unique approaches to cognitive restructuring, behavioral change. These are the 2 things that are targeted in cognitive behavioral therapies. Cognitive restructuring, the restructuring of negative and maladaptive, harmful thought patterns, and this is called changing them through the process of REBT or CBT. Cognitive restructuring. You change the thought patterns, which will result again in changing in behavioral patterns to more adaptive. These are the traditional cognitive methods that I spoke about: cognitive therapy, Beck's model, then rational emotive, mindfulness, schema therapy, and behavioral activation. Slide 4, Peter. Thank you. Yeah. This ABCDE model, this is the model of rational emotive behavioral therapy. And it is actually a breakthrough method, through psychotherapy, because ABCDE stands out actively, and it actively also restructures the thought patterns as we just discussed, and it can be adaptable across any issue. ABCD is a universal framework, and it can be used for anything that your client comes to you with that they need help for. In this, the adaptability is very, very versatile in REBT. If you do it, you will learn. And it also helps the therapist, and gives practical results. And it's result-driven approach that ABCD, that particular formula, is focused on to create very lasting transformations in your clients. Just to explain to you, A is an activating event. That means that anything that happens to you that results in a negative thought patterns, negative behaviors in a person, maybe a simple thing to major things. Sometimes it can be just a negative comment at work someone is giving you. Maybe your employer may say something that is, disturbing to you. Maybe your work is not done well, any of the sort. Or from there, when that happens, if you receive a negative comment, let's say, you will form a belief. This comment comes to you because I must be terrible at my job. And in the end, I am not good at my job. I'm useless, and on. This is a belief that if you really think of it, think of your own experiences at this point of time. If you have received something negative comment from anybody, any kind of negative event, disturbing event, the person who receives it will form an opinion about it. This is called the belief. This belief is what that causes the consequence. That means it causes anxiety, self-doubt, and then you can be avoiding situations that you are disturbed about, and on. That consequence is the result of that belief. Contrary to we believe that my boss gave me this bad comment and that is disturbing. I'm very upset about it and I feel very low. I feel small. But according to the ABCDE model, what disturbs you, what gives you that anxiety, self-doubt is that belief you formed in your mind regarding your boss's comment. Once these 3 identified in the process of ABCDE, the most important, the bottom line is what kind of belief are you having regarding this particular incident, regarding whatever negative comments you received, and that caused you to be anxiety and have self-doubt and all that. We identify these beliefs, and then because now we have said belief is the cause, and that is what is the causing the consequence for you. If in that case, if you change that belief, then your anxiety, if it is unhealthy, negative, then the anxiety can be much more lessened and it can come to a healthy level. We take this belief, and then what we do the process called disputation. That means, is this really true? Could there be another explanation for I must be terrible at my job? Is that really true just because that person told that? Where in the word is that written anywhere? Is it we may explain to your client, to our clients, that I must be terrible, and where is the evidence for it? And we do this very beautiful, questioning called disputation. We question the client's belief, and then we make the client understand that your belief is what is causing you this much of discomfort. And if you change your belief to a more, adaptive, rational belief, then your discomfort is going to be much less. We are not telling that the discomfort is going to be zero. We never do that. But it is being the discomfort may be negative, but it is still healthy. Healthy level of belief, the consequence is what we want. The ones that we find out, we do the disputation and your client understands that it is actually my belief that is causing my consequence, and we integrate that positive, and we find what are the alternate beliefs that we can have that may not make you anxious or so psychologically or emotionally disturbed. Then what we do is we integrate those healthy negative beliefs into your client's belief system. This is what happens in this ABCDE model of REBT. Out of those, why ABCDE is the best model? If we look at it, all the models are good that we spoken about earlier. But the ABCD model of REBT is particularly powerful because it actively restructures the thought patterns, which is the cause of your disturbance. ABCD framework, that means A is the activating event, B the belief, C the consequence, D the disputation, and effective new beliefs that acquired by the integration method. Is very, very structured, and it is a easy protocol to apply. It's a very easy to apply method and helps a client directly challenge their own internal irrational thoughts and replace them with healthier belief. It is a training process for your clients. They will learn to do this even on their own once their current issue is handled and they realize and they become much better with their emotions, and they are very well equipped to do that again if they go through another similar kind of disturbance or anything else different. It also most very rapid and lasting change. The change that occurs in REBT is really lasting, and it will get ingrained into you, and it will start making you look at life's events in a much more healthier way. Unlike passive reflections, ABCDE it will encourage active disputation of the client's unhealthy beliefs that they are holding on to. And it makes it highly effective and breaking self-defeating cycles very quickly because of that particular beautiful process that you take your client through from the A to E. It is also, as I said earlier, it is adaptable across all client issues, whether working with anxiety, depression, addiction, traumas, panic, phobias, anything. The ABCD model provides a very universal framework. You can adapt it to treat your client, help your client with any kind of psychological disturbances due to any cause. It's good. It changes unhealthy thought patterns and emotional problems, thereby changing also their behavioral patterns. CBT is a game changer. But ABCDE takes it further by giving you, the therapist, a practical result. And it is a result-driven approach that is very effective to creating deep and lasting transformations for your clients' difficulties. CBT was the first form of psychotherapy tested with the most stringent criteria. A lot of research have gone into it, randomized trials and active comparators of criteria with evidence-based frameworks. That's what they have used in the health field. It's very comparable to those that are used in case of pharmacotherapy. Therefore, it was the first psychotherapy largely identified as evidence-based in most clinical guidelines, along with all those interpersonal therapy you have heard for depression and on. I like to just mention to you the basic principle of REBT, what it is based on. It is based on emotional responsibility. The Ellis promotes that what we feel is us. We are responsible for our emotions. And the whole REBT process is based on that. It's a very old philosophy that Greek philosopher who lived in the 50 to 150 BC, somewhere around there. And he is the person who came up with this philosophy that what we are disturbed about is not the event, but the will we hold about the event. The whole of REBT is based on this. Let's say a client explains that his father makes him angry, and that is why they end up arguing each time they meet. You can put in any kind of situation, but easy to understand. If you are the therapist, you can ask. You say that your father makes you angry. The client will say yes, and every time we fight and we argue, and it's never a good time between us. The client, then you, as an example, you ask a client to just think of 100 people who are very similar to your client, whose fathers are also almost similar to your clients. And these 100 men of similar age, similar background to the client, who all have the same father, who behave the same way, more or less. And then the client can be asked, all of those 100 people all of those 100 people, will they feel exactly the same as this client does? Will all the 100 people feel the same way as you regarding your father? If the client responds negatively or suggests that most people would, then the therapist will ask, if some of them are the same, what about the others? What are the other people can be feeling? You go on guiding your client to understand that same event will result in different responses in different people, because the way they think of each person thinks gives a different response. You can talk about like if your father, like the event is, my father insulted me. The person got angry. You can ask, what thoughts came just before you got angry? If you get angry, there must be some certain thoughts that made you angry. That generally the thinking or the cognition will be, this is injustice, I don't accept when lines are crossed, I will give it back to my father. That kind of thoughts creates anger. But if the consequence is a guilt, that person will think, my father is right. I am a useless idiot. I am not a good son, and I deserve this, and accepting their behavior. Another person can become very, very amused about the father's behavior. Those people will have the thoughts that, oh, he's an old man. He can't change. What he says is not true. And he is cute when he is angry, and so on. They can laugh at it. And also other people get depressed about whatever. The people who get depressed can have different thoughts. Like, it is ridiculous. I have done so much for my father. I can't get even one word of love from him. And I feel very depressed about it. This pattern, this is how you will understand the consequence of negative emotions, unhealthy psychological disturbances come from the way you think about the event. That is actually the basic principle of REBT. I would just like to let you know about a client I had. This person is a highly educated, very rational, intelligent, qualified person. But he had severe anger issues, and he did not know how to manage. He was sent to me. His problem was he held an absolutely very, very responsible job, which he had to be day and night at work. Due to difficulty in balancing work and family situation, then he started developing anger, and because the spouse was very disappointed with the situation, because she was living alone in this country, this person was an expatriate. The client could not find a solution, and anger started developing because on the work side, much stress, family side, much stress, and he developed this maladaptive response. And he was just throwing tantrum at everybody. Then family staff started getting affected by his tantrums. One day, wife suddenly left him with the children, and the client could not cope with that. He came and he explored everything, and ABC principle was explained, then emotional responsibility was explained, 100 people technique was explained, and we identified the irrational beliefs. He had many irrational beliefs. And his first thing was he was hurt. His emotion was deep hurt, and which caused him to express it in a maladaptive anger. Then the emotions and resulting behavior were identified, and the hurt, the anger, the tantrums, and then the REBT protocol was followed. We identified his very unhealthy beliefs that he could not let go. I should not have been treated like this. My wife should not have gone away with my children. And so many unhealthy beliefs he was having regarding that incident. And we processed everything, took him through the process. And in the beginning, he was trying to understand, but with good explanation, he understood, and gradually his thinking pattern changed. And he understood that, yes, it was a very bad thing that happened, but it's not the end of the world bad. I can take some steps to, rectify this. And all the anger changed into processing the whole context of the whole thing, and developing new good beliefs, healthy beliefs. And he finally took up the challenge, and he left the job and went and joined his wife and children and in his country. And he sent a message to me telling that was the best thing I could do. And I'm really happy now. This is one of the many examples you can do, and how the thinking pattern changes when you take your clients to REBT. Okay, you can go with the rest of the slides. Yeah. So this is just a graphic about this. The purpose of CBT is to transform thinking, and thereby also transforming behavior, and thereby change the client's life. The thoughts, feelings, behaviors. This is the cognitive triangle that we will be addressing. Everything this is called psychological interactionism. Everything will affect the next thing. The thoughts affect feelings, feelings affect behavior, behavior goes back to thoughts, and on. This is the cognitive triangle. Something very powerful, which explains why human beings get so disturbed. Because according to Ellis, he has researched much, and he has come to this conclusion that according to him, human beings insist that there must, three very rigid beliefs that hold us back from progress. One, I must do well. By any means, I must do well. And you must treat me well. And the world must be fair to me. When people hold these three kinds of beliefs, now rigid beliefs, then there is psychological disturbance or emotional disturbance. In RA, whoever has which one, you take them through and change that pattern, telling, yes, I would prefer to do well, but if I don't, that is not okay, but I can take it. People must treat me well. You change the thinking pattern to, yes, I would really like everyone to treat me well, but if they don't, it's okay. And then the next one is the world must be fair to me. Must be fair to me. This must is the very damaging word that we are changing. The world must be very fair to me. Then we change it through REBT. We change that belief into, rigid belief into, I would really like the whole world to be fair to me. But I know it cannot be done. And I'll be okay if the whole world is not fair to me. These musts are the ones that we change through REBT to flexible beliefs instead of these rigid beliefs.
But just to let you know, our next CBT course begins on the 8th of September in 2025. There's a date for your diary. What I'm going to do is I'm going to stop the share now, and we can all see you all, and open the floor to any questions you may have about CBT, about the course. I mean, it's a very interactive course. It's a great way of understanding yourself and the process. We do bringing cultural considerations into it as well, because there are certain cultures where perhaps people are not used to challenging themselves. CBT and REBT have evolved very much with regards to working with that. Anybody got any questions that they would like to ask us? please do We Don't Bite, and we will answer any questions as long as we know the answer. Now, I'm an integrative psychotherapist, and I bring these skills into everything that I do. My prime discipline was hypnotherapy, still is hypnotherapy. I absolutely adore hypnotherapy. But when you're bringing in elements from CBT into what I do, or when I'm practicing with ego state work, I even do energy psychology. Again, all of these can be brought together to the benefit of the client. And I also think, and Dr. Sumitra will agree with me, that when you look at research, combining CBT with another particular approach to therapy enhances the outcomes. You can have two therapies that are very good on their own. For example, when you look at therapy, we look at people presenting with depression. Hypnotherapy is great at working with depression. CBT is great at working with depression. Pull the two together, the outcomes are enhanced. I do a lot of trauma work, hence my passion about EMDR, but as you can probably imagine, people presenting with trauma hold some very interesting beliefs and very restrictive beliefs, and that's again where the CBT skills come in. But a question here from Amy. Dr. Sumitra, hi, I have a question just to feed my curiosity. We love that. Everyone is responsible for their own emotion, but do we as people around responsibility for their emotions? Like, we need to understand them. Some people always use cards like, this is just the way I am, you need to deal and accept it. What is your opinion? How do we differentiate between your emotion being valid and what you feel is valid?
All right. In REBT, it's whoever you're talking about, like people make this kind of statements and all that. Are you disturbed about it? If you are disturbed about it, you can be disturbed healthily or unhealthily. If you just think, okay, this person, yeah, whatever the person is telling is their opinion, but I am free to have my opinion. I don't really much bother about it. You may be a little bit disturbed, but you don't really go too much into it, thinking about it, ruminating about it, and then disturb yourself. But if somehow something happens, if someone says something really, disturbing to you, then you will get disturbed in an unhealthy, negative way. These unhealthy, negative emotions are the ones that cause all the issues in our human beings. We hold unhealthy, negative beliefs. When you have that, it is important that you change those unhealthy negative beliefs to healthy negative beliefs. And REBT is geared to doing that. I know what you're talking about. People will say, you must understand that you are responsible for your emotion. And the other person, they are exactly the same, responsible their own emotions, but they don't want to accept it. You can't do much about it. Their disturbance, if they're happy with their disturbance, then you can't forcefully change people's ideas and beliefs and and emotions and all that. But we are talking about ourselves, and we are talking about current disturbances that we are going through for whatever reason. It may the disturbance may have started somewhere some time ago, but what are you feeling now? And we deal with that, what you're feeling now. If you take the course, you will understand how beautiful this philosophy is. And it's simple that you sometimes wonder, how does that work? But actually it does. I'm not sure whether I answered your question. We need to understand them. It's not understanding them here in REBT. It is understanding that you're responsible for your emotion. And once you understand that, then you work on it, that you get rid of your unnecessary burdening, emotions to a more milder version of it where you can go forward with your life, not bothering too much. But you can't change others, you can't anyway. Even with medicine, you can't change people. It is cost more for psychotherapies. I'm not in the profession, but find the CBT interesting. Peter?
I think PC. Sorry, I don't know your name. Have a chat with Naz. Depends what your background is. You don't have to be a psychotherapist to benefit from this. You could be in coaching. You could be in gosh, the name of it's completely gone. Well, I keep wanting to say PR. You could be working with people in a company and wanting to understand
Human resources.
HR. Thank you, HR. What I would do is I will recommend you talk to Naz, and we can find the right routine for you.
Yeah.
Just also going back to what Dr. Smitra was saying with regard to the question that was just asked. One thing I took out of my training with CBT, REBT, comes from religion. Take the religion out of it, it becomes a philosophy. And very simple, it's the serenity prayer. Grant me the wisdom to accept the things I cannot change, to change the things I can, and the wisdom to know the difference is a really good way of working with people in this type of situation. We can't change somebody else directly. What I have found is if we own our response, being able to change our response in a way that it meets the needs of any situation that we're challenged by, through our change in behavior and thinking, we can change the nature of interaction. I'm not going to say you can change that person, but we can change that nature of interaction. The angry person is coming up and constantly angry at us, and we're feeling angry back and we're wanting to fight back. If we work on our anger, we can calm down, which doesn't give that other person the triggers they need in order to come back at us. And that is a way of working with helping to diffuse situations. But we cannot, as Dr. Smitra says, we cannot change people.
If I may add, it's an interesting thing that I just 1 or 2 minutes. Now, hypnotherapy works at the subconscious level and CBT works at a conscious level. Very often, many people go through those, very disturbing behaviors, trauma and everything that can be very well managed with the hypnotherapy and mainly with hypnotherapy. But with these people, they can have, like Peter said, they can have beliefs that are in here. Once they get better, they may stay with certain beliefs that are not very beneficial for them. And with CBT, this belief thing can be very well handled. And of course, drug dependency, alcoholism, and many other things. They will have their first line of therapy like rehabilitation and all that. But as they get better, the CBT therapist can go in and manage their beliefs that they can be, the thinking patterns can be much changed. The rehabilitation is mostly physical by all that kind of, cold turkey and whatever not they use. But and also even for self-esteem, confidence, you can use REBT, can use CBT. It has been done and I have done it and it's very, very, very effective. Yeah. And the other thing is, even if you are doing hypnotherapy, let's say, you can take some exercises and some philosophies from CBT and you can integrate into your hypnotherapy or any other kind of therapy you are using. It's easy to do that. I always do that. There are so many exercises that I just pluck from CBT and then put it into the therapy plan of hypnotherapy patient. It's very versatile. It's strange though, but it can be done. It will be useful anyway, whether you are doing REBT per se or you are doing any other psychotherapy, but you can borrow from REBT and use that. All the time you can do that. So many beautiful techniques. Yeah.
What always makes me smile is everything sounds easy to do. That simple question, how am I allowing myself to be disturbed by this? It sounds easy to ask, but then you've got to have the courage to listen to your answer. And that's what we're working with our clients as well to do, to have that courage.
Yeah. And many people, including the students who have done CBT with us, they make it their way of life, actually. They tell me. Yeah.
Thinking about the ABCDE model, again, such a simple concept. In practice, not as simple. Okay, everyone. Well, thank you, Dr. Sumitra. Thank you. If you've got any questions about the course, do let us know. If you want to ask any questions about the content, then let us know. We can pass it on to Dr. Sumitra. And we hope to see you all very, very soon, hopefully on CBT course or in some other context as well. Thank you very much for joining us today, and we'll see you all very soon. Bye-bye, everyone.
Thank you, everybody. Bye.